So our programs, we have two programs for AI. One is bespoke for educators in healthcare. The other one is for healthcare professionals, practicing professionals. We'll just take you through these slides. They're not too long. So our the purpose for this course or this program is number one, or initially, we're seeing a transformation in healthcare. So AI is here to give us enhanced clinical decision support and diagnostics, improved patient outcomes through data, and moreover, very importantly, more efficient workflows and better administrative output. So, and we're also on the cusp of a revolution in the industry. So, at this point of time, we're producing personalized learning for students, new assessment methods and feedback tools, and moreover, simulation and skill development opportunities for anyone who joins our programs. Okay, the courses will enable us to explore AI applications and develop practical skills. Very importantly, work with ethical considerations, data privacy, for example, or bias within the populations we're working with. And that takes us into the world of statistics a little bit. And moreover, the implementation of AI solutions in a clinical practice. So we have a course overview. We have shared course topics. These are the content. Course for this, we go through the course for health professional educators and then professionals, the implementation timeline that's planned, our audience for these courses, and our forthcoming steps. Okay. So for educators, the course aim is to equip health professional educators, with knowledge and practical skills to leverage AI in education, assessment, and curriculums. The key goals are literacy in AI, so understanding the ins and outs of artificial intelligence, what it means, and naturally, we'll be developing our lexicon on AI terms. Ethical implementation, as I referenced a little bit earlier on, the practical application, how AI works within this healthcare framework, especially one that's pertinent to education, and moreover, in innovations in the study. Okay. So learning goals and outcomes for educators to develop an understanding of AI fundamentals, to integrate AI tools in teaching and learning, and again, apply AI ethically and creatively. So learning outcomes, identify pertinent, appropriate AI applications in education, and also develop an ability to assess various or differing AI tools suitable for healthcare learning scenarios, to construct effective AI-driven assessments, to use customized GPTs in the learning framework. And also, once again, we keep saying this because it's so important, address ethics in education when it comes to AI. And that also includes matters such as evaluating the AI response and using the human in the loop model to evaluate and audit AI responses. Now with professionals, the aim is to empower healthcare professionals to use AI for better patient care, for research, and effectively or fundamentally for clinical decision making. The core goals are to apply AI to enhance clinical decisions, develop competency in AI research models and methods, to master ethical implementation of artificial intelligence in healthcare, and to build one's practical skills in developing AI-based or AI-founded clinical solutions. So what do we expect within the workplace? Improved, better diagnostic accuracies and treatment plans, improved patient outcomes with respect to predictive analyses and diagnostics, and moreover, risk assessment, more efficient clinical workflows, of course, very important within any work setting, and better resource allocation, sorry, and advanced personalized medicine approaches or treatment approaches. So the goals: to understand, to appreciate the impact of AI in healthcare practice, and to develop skills in artificial intelligence-enabled research and clinical assessment. And yet again, ethics ethics in the effective use of AI, dealing with matters such as data privacy and statistical bias, and moreover, being able to audit and evaluate the AI response. Learning outcomes for the professional: apply prompt engineering for clinical research, and to customize GPTs for decision support, understand machine learning for healthcare, and navigate ethical considerations once more. So, course topics. The foundational modules will be covered in both courses, providing essential knowledge and skills for participants. And that these include an introduction to artificial intelligence, to develop a base, of course, to the field and to the subject. So AI fundamentals and terminology, again, to develop and build a lexicon, to understand different types of artificial intelligence, how artificial intelligence is used in healthcare, and understand capabilities and limitations at this point in time. So prompt engineering, which is the next area that is going to be one part of the foundational curriculum. Techniques, which is based on techniques to effectively communicate and leverage AI systems for optimal results, to be able to model effective prompts, to use advanced prompt strategies for better responses or more efficient responses, to be able to direct the context of the AI model, and work with a specific or healthcare specific again framework. And then we go on to AI in research, leveraging AI tools to enhance healthcare research methods and outcomes. So again, very helpful: literature review, automation, data analysis and visualization, research method support, and of course, of critical importance, publication assistance tools. Right. AI for healthcare professional educators, again, sorry, am I on the wrong slide? Yeah, that was right, sorry. Specific topics. Using AI for teaching and learning, learning, understanding, or being able to develop customized or bespoke learning pathways for one's students, um, being able to utilize AI-enhanced simulations and case studies, and again employ in the virtual sense or digital sense teaching assistants and tutoring systems. Again, working with customized GPT for health education, developing speciality-specific AI assistants, creating content and materials, and building interactive question and answer systems for one's classroom. We're also going to look at AI in assessments, automated grading and feedback systems, testing methodologies, and competency tracking and skills evaluations. And again, back to that fundamental matter, ethics. So academic integrity and AI generated content within the classroom, data privacy, and equitable access to one's classroom or cohort. As for the professionals, topics include AI for clinical teaching and assessment, AI-driven clinical use simulations, personalized clinical skill development, and objective assessment and clinical competencies. Sorry, I have to run through these. Customized GPT for healthcare, machine learning for healthcare, and again, ethics in the use of healthcare. So timelines, I'll quickly run through these. The course registration or course registration begins in September. October, we have orientation pre-course materials. Later in October, we have the launch of Module 1, and January 2026 will be course completion. We also have a phased implementation approach that we will be discussing further should you have any further questions. There's also a flexible completion time frame which works within 3 to 4 months, I'd just like to mention. So thank you very much, everybody, and we look forward to hearing from you. Now on to Professor Hussain. Thank you.